Okay, perfect. Well, thank you everyone for joining us for our Physician Perspectives panel. We'll start just by introducing ourselves, and then we'll go into some of the questions that we prepared for our attendings that have very graciously taken the time to speak with us tonight. My name is Vishnu. I'm an MS4 at UCLA. Finished applying diagnostic radiology this cycle. And yeah, Michelle, you want to take it away?
Yeah. Hi, everyone. Thank you so much for coming. I am a MS1, also in the Prime LA program, and excited to go through this panel with you guys. So, as Vishnu mentioned, welcome to our Physicians Perspective series. During this series, our goal is to have different physicians from different specialties come on and talk more about what they do and what a day in their work life consists of, so we can really see, what the potential specialty we're interested in entails. So this specific series will highlight the diverse experiences and perspectives of these phenomenal UCLA physicians who have committed their careers to servicing different areas of sports medicine. Our goal today is to provide you all with a deeper view into what exactly constitutes the subspecialty of sports medicine and the primary specialties that these physicians have come from, what a typical day is like, what the training consists of, as well as some additional more personal topics, and then anything that comes up in the Q&A. So this session will be recorded from about the first like half hour. We hope this will allow students who are not able to attend to listen at a later time, and for everyone to be able to come back to this and reference it in the future if needed. So please direct any questions that may come about during the session to the Q&A portion, and you can put it in the chat. We're a moderator, so Vishnu or I will compile them by topic to be said aloud during the Q&A portion. If you prefer to say it verbally, you can also save it till the end, and then we'll have a raise hand function then. So thanks for joining us, and yeah, we hope you all learn and enjoy from today. So just to get into why we're all here, I would like to begin by allowing our physicians here today to introduce themselves and like what sports medicine is to them or what it entails in their specific specialty. And then Dr. Salani, I'll have you go first.
Sure. So thank you guys so much for having us. I think it's great that you have our sports surgeons as well as our primary care sports medicine physicians on the call. So I am a primary care sports medicine physician. I did my residency in family medicine. I grew up in Chicago, and then I ended up going to medical school out in Henderson, Nevada at Tour University, Nevada, and then did my residency back in Chicago in family medicine, which is a 3-year residency, and then specialized in sports medicine. And UCLA was my top choice for fellowship. So that's how I ended up out here about 5 years ago. In 2019, I did my 1-year fellowship training, and then I stayed on as an attending afterward. And the patients that I usually see are non-operative, and so for the most part. And so basically, sports medicine for me on an average day looks like treating injuries, other conditions, sometimes arthritis that affect active people and athletes of all ages.
Thank you so much.
All right, so I'll go. We have a little guest here too. She was very excited to see me, so she picked me up from work today. This is Katie. Katie, can you say hi?
Hi.
I am an orthopedic sports medicine surgeon. We work very closely with a non-operative group. I did my med school and undergrad and med school at Brown, so I was in their 8-year medical program there. And then I matched at UCLA for orthopedic surgery. It's typically a 5-year program. It was delayed, so I did an extra year of research. So I took 6 years to finish my residency. I did a year special subspecialty training, which I would say 95+% of orthopedic surgeons do, a fellowship. So I did mine in sports medicine and shoulder surgery up in San Francisco, where I grew up in the Bay Area. And then I was fortunate enough that my mentor, Dr. Pasciugliano, got a new job at USC across town. So I took his spot here at UCLA, which was the job that I wanted. So I do sports medicine and shoulder surgery, which means that I do. Joshy. Yeah, it's Joshy's. So which means that I do like ACLs, meniscus surgery, shoulder replacements, instability, rotator cuffs, like Tommy John type surgeries. And I also take level 1 trauma call at our hospital and do trauma. And then my sports coverage, which is sort of extra to all this other stuff that we do. I cover the UCLA men's volleyball team, women's gymnastics, and men's baseball. And then this year, my mentor, whose job I took when he left USC, was hired back to UCLA, which was awesome. And we took on the LA Chargers football team. So I'm a part of that medical staff as well. And Sabrina's shy, but she is going to get a World Series ring here because she works with the Dodgers here.
I forgot to mention any of my sports coverage. Sorry. But as Dr. Chung said, I help with the Dodgers. So I covered 20 regular season games, 4 postseason games. I was at the game where Ohtani had subluxed/dislocated his shoulder, and then we won the World Series, which has been awesome. So hopefully we'll be getting a ring in the spring. And then I also help with women's basketball and their primary care sports team doc, UCLA Swim and Dive. And then I help Dr. Defoe with the Sparks as well.
We just had our third panelist, Dr. Defoe, join. I'm Dr. Defoe. We just finished introductions with Dr. Solani and Dr. Chung. If you want to just briefly introduce yourself and what you do.
Cool. Yeah, sorry for being late. I apologize. CJ Defoe, one of the primary care sports docs. I've been here at UCLA for 10 years now. Kind of a normal clinic in primary care sports, and I take care of a lot of teams. The primary teams I take care of is UCLA men's basketball. I help out with UCLA football, and I'm the head primary care doc for the South Bay Lakers, along with the LA Sparks, and I do help out with the Los Angeles Lakers as well. And I had the amazing opportunity to work with USA Basketball this summer. I was in Paris for the Olympics and got to participate in the care for those incredible athletes out there.
Thank you so much for sharing that. I really appreciate it. So going off what you all said, I'm curious to know, on an average day to day, how much would you say you dedicate your hours to the clinic, versus research and medical education, if any of those do apply to you?
So I can go first. So my usual day is typically about 8 to 5 in clinic. And then on top of that, if there's game coverage or training room, which I have tonight, then I go do that for 2 to 3 hours in the evening time. Tuesday, I have a game in the middle of the day for women's basketball for whatever reason, so no clinic that day. And then weekends, you sometimes have game coverage too. So we have our first UCLA women's basketball game this Sunday. And so sometimes your weekends, your nights get taken up by work as well. We try to find time to do research projects during the year as well, sometimes with the fellows, sometimes on our own. So sometimes like a half a day is dedicated for research. And then with our fellowship program at UCLA, we usually have a half day dedicated for academic work too.
I'll go. So it depends on what I do. So I have a few hats that I wear, similar to all of us. So I have a full day clinic on Mondays, and that usually goes from 7:30 until usually 5:30 or 6. I see about 40 patients in that clinic on Monday. Tuesdays, I alternate between clinic and OR. So OR, we're in the room at 7:30, which means that I'm usually there by 6:45, 7 o'clock in the morning. And if it's a full day, then that goes until we're done. So usually about 6 o'clock, 5 or 6 o'clock at night. If it's a clinic day, it's a half day clinic. So I'm usually done by lunch, and then I might drive across town and do some other stuff, or use it as research or whatever else. Wednesdays, we usually have our academic time with fellows or residents or faculty meetings or grand rounds. Faculty meetings, unfortunately, have started at 6 o'clock in the morning these days. So it's ungodly early. And those are long days. And then I work out of all of you also. So on Wednesdays, I move around a little bit. I might do faculty meeting or some teaching, and then I do a case or I'll do some admin time in the morning, and then I drive to UCLA to do training room around 11 for our athletes there, and then I drive up to all of you and do clinic and supervise the residents there until we're done. Thursdays OR all day, so I was there at 6:45 this morning, and I just got home. Um, and then Fridays used to be all day OR at the county at all of you, but now I do one case in the morning, and then I go to the Chargers facility to take care of them with for practice and training room there. And then weekends, it's football season, so every Sunday is taken. We're there 3 hours ahead of the game. And then we're usually there about 45 minutes to an hour after the game. So it's about a 3 hour game. So 1 to 4 is typically it is. We're there at 10. And I get home around 6:30 on Sundays. And then call is 24 hours. So I take 4 level 1 trauma calls a month. And I was on call yesterday. And nothing happened, surprisingly. I didn't even get a consult, so that was amazing. But I went to Bakersfield yesterday, gave a talk for industry, so I'm involved with industry as well. So yesterday was 6 in the morning till 11:30 at night. So it depends on the day, but our schedules can be fairly busy with game coverage and all that other stuff. Research and family is sort of in between all of that.
Yeah, I mean, I feel like for us, it's every week, every month, it's different. I think the easiest way, I'll tell you how my week went this week. So Monday, I have my regular sports clinic where I see mostly adults, and then Monday night, I had a UCLA basketball game from 7:30 to 9:30, 10. Tuesday, all day sports clinic, and then I had training room to see UCLA athletes that are injured, sick, or whatever. Yesterday, we had a 6 a.m. faculty meeting, which was really awesome. And then we had interviews for people applying to fellowship, and that was from 7:45 to about 12 o'clock. And then I had a clinic in the afternoon on Wednesday. Today, I'm downtown at our Orthopedic Institute for Children, where I see only pediatric sports medicine cases and fractures. Tomorrow, I'm going to get on a plane and go to Vegas or outside of Vegas for men's basketball. We play in Henderson against New Mexico State. I will fly back on Saturday morning. I will work a South Bay Lakers game on Saturday. And then Sunday, I will work a Los Angeles Lakers game. And in between, I'll be reffing soccer games and trying to watch my kids play sports.
Wow. I don't even know what to say. I'm just grateful you all are here because you clearly have very busy schedules and I really don't know how you do it. But I did want to like bridge what we're currently learning as MS1s. We're in our MSK block. And so we're like learning about like rheumatology, PM&R. So how would you all say that you've seen sports medicine kind of interact with other specialties when it comes to like cases or patients?
I think it depends on the setting that you're in. So all of us work with professional sports teams, and we work really closely together. So, at least for actually all the teams have a non-operative. So either Sabrina or CJ or one of their partners, and an operative surgeon, which is myself or one of my partners. And so there's very close collaboration most days amongst for any of the issues that might be coming up with the athletes. And then things happen. So like if somebody has a pilonidal cyst or something, we talk to general surgery about that. We are heavy users of imaging. So we have certain radiologists that we partner with and talk to them about our scans for all the players that we see. And then every time somebody gets a pre-participation physical for any of our at least for football. It's probably the same for Lakers and Sparks, but they get EKGs and lab work and all this stuff. And then if you need second opinion, like that gets cleared by cardiology. So we are pretty collaborative, I would say, in terms of our specialty, especially when we start working with our level sports. And then in the OR, right, there's anesthesia and nursing and all that other stuff.
We also collaborate a lot, like Dr. Chung was saying, with brain sport or our neurology division too. So they have a really great concussion specialists. And so we work really closely with them. Sometimes they'll help with some of the concussion testing preseason, or if there's complicated concussions or prolonged concussions during the seasons for any of our sports, they work really closely with us too. Within our orthopedic department, we also have PM&R docs. They specialize in spine. And then actually we just hired a PM&R physician who specializes in sports medicine, which is the first one that we've hired through our sports medicine division. And she's awesome. And so we're really excited to be able to kind of work with some of the other primary specialties who also contribute to sports medicine.
Yeah, I mean, I would echo it. One of the reasons UCLA now is partnered with a lot of professional teams is because of that collaboration that we offer as a major academic institution. Is that we have all the specialties that work together, and I think part of us as team physicians is we help bring them all together and kind of gather all information and present it to the team and help make sure the player understands all of it. If you specifically write, Samir was talking about PM&R, we also have rheumatology, which I've had a couple of patients where there's a lot of MSK crossover between the two, and there's sometimes it's a rheumatological issue. And we've had a couple of PEDS cases where the rheumatologist kind of wanted to have their knee aspirated and they didn't feel comfortable doing it. But we do a lot of procedural stuff on the sports medicine side. And some of us are much more comfortable working with kids and feel fine doing it. So we'll collaborate that way. So I think that's the beauty of being in an academic institution is that collaboration between all the specialists.
Thank you. I did want to end this recorded section by asking, we have a lot of current medical students here, and then I think we do have some pre-meds for students that want to like get more involved with sports medicine, whether it's through family med or orthopedics. Do you have any suggestions like programs, internships, or even volunteering that can be done, whether directly through you all or through some type of program that UCLA offers?
When I was in college, so I went to college at Northwestern in Chicago. So I was actually a sports medicine aide for our football team, and you can be a sports medicine aide or a sports medicine intern when you're an undergrad. So if there are pre-meds on the call who are interested in that, you can apply. They usually will have like a training year, see who's actually interested, kind of see how you do with some of the different sports. But then you get, to shadow the physicians in their training room clinic. You get to shadow the athletic trainers and help them with some of the treatments, the physical therapists there. So it's a great way to really see how all of the different specialties in sports medicine interact from a very young start in your career. Which I really loved. And then in medical school, I did a few rotations actually in sports medicine, which kind of allowed me to see, okay, would it be like to be a physician in sports medicine? And I did in orthopedic surgery as well as with the family medicine, sports medicine doc, and tried to see which one I preferred.
I can get more information later, but there is some program that all of the NFL teams have where there's a med student who takes care of the refs. And they actually, it's like the coolest thing. I had no idea. But somehow, like, there was somebody that was taking care of the refs in that training camp. And school started and he had to go back to more clinical duties. But, he comes to practice and helps out and, had jobs and stuff. And he knew more about the Chargers because we just took him on in August, and July. But he basically was with them a little bit longer before we did, so he was showing us the ropes a little bit. So there are opportunities like that. I would say though that like if you are early in your medical school or in your pre-op or pre-med or undergrad years, and like just do something. It doesn't necessarily have to be sports medicine. Like don't pigeonhole yourself. Um, so very similar to what I tell the interns and the junior residents, like don't pigeonhole yourself into sports medicine early in residency. Like go and do well in all the subspecialties within orthopedics. And I would say the same thing to you guys at just a different level. So when you're in medical school, just learn as much as you can about, medicine, cardiology, all the different things. Even though we feign that we're not very smart as orthopedic surgeons, I think we all did um, well in medical school. Um, and I see it. And I think that's really important. And then as an undergrad, I think that you can do, okay, I'll put it in my pocket. Um, as a undergrad, I think it's really important to just get a wide breadth of experiences within the healthcare system. Um, I think you can volunteer. Like I volunteered in the recovery room when I was in high school and college. And I was an EMT when I was in and worked in an ER as an EMT and a tech when I was in college. And then and I found that like kind of helped me just decide that I wanted something procedure based when I was coming out. That would be my advice, but there's certainly a breadth of opportunities you can come and do research. That's usually one way of getting involved with the attendings. And shadowing is a little bit harder because we all have medical students that are all part of the service and residents and stuff. So they're a little sensitive about who can truly shadow, like in clinics and ORs and stuff, especially if you're coming from an undergrad setting. Once you're in medical school, it becomes a little bit easier because you have ID badges and you've been oriented and all that stuff.
So I know UCLA has a sports medicine interest group. One of our colleagues, Dr. Miller, is actually one of the faculty mentors for that, and that has been a good way to get involved in sports. We actually have put on panels where we kind of do similar stuff for the group, and then there is a little bit of a shadowing experience for some people at like high school football games with our fellows. So that's kind of getting into some of the sideline coverage that we do as sports medicine physicians. I do agree with Ed. What he's saying is just getting involved in medicine anyway, just to kind of, especially in undergrad, to see if it's something you want to pursue. Like it's a long adventure. That once you start med school, and there's usually not much of a break once you start med school until you're done with residency, and even then you're going into being attending. So I think getting a real idea of experience around it. I worked in an ER for a couple of years in between undergrad and med school, and just kind of saw how the interactions between physicians and nurses and other staff went. And then it was kind of like a whole team atmosphere that I really enjoyed, with a little bit of mental challenge from the medicine part. That was great. I do think there are in med school, when you think about sports medicine, there are multiple ways to go. If you want to be a primary care sports medicine doc like Sabrina and I, you go through different specialties. For Sabrina is a family medicine physician. I was actually trained in med peds, so it's internal medicine plus pediatrics is the residency, so you get a little bit of both. You can do it straight from medicine or straight from pediatrics. You can also do it from ER or physical medicine rehabilitation as a residency. So I think you can find like a general training that you really like, and then still specialize in sports medicine to the primary care side. So I think there's a lot of different avenues you can go through to it. I also think it's just trying to reach out, finding a mentor to kind of help you get through it, because it's could be kind of a confusing, stressful path just to figure out what you want to do. And I think the more exposures you can get, the better understanding you have of what's out there and what truly meshes with your personality and style and how you want to do things later on.
All right, thank you all so much for sharing. I think now we're going to cut to our non-recorded portion of this session.
Let me just confirm. Let me just stop the recording and just confirm that